Hello, this is our oral health in service presentation. We are from the University of Bridgeport Foam School of Dental Hygiene. Who are we? The first school of dental hygiene in the world. We are senior dental hygiene interns. I am Patricia. I'm here with Gina, Giselle, Julie, and Nicole. So a brief history of the Foam School of Dental Hygiene. It was originally established in Bridgeport, Connecticut by Dr. Alfred Fones. He was a dentist in the area. Dr. Fones realized that we should not wait for dental disease to occur to treat it. We should prevent it. In 1906, Dr. Alfred Fones began training his cousin, Irene Newman, as a preventative oral health specialist. By 1913, Foam School of Dental Hygiene was opened officially. The first dental hygienists worked in the Bridgeport Public Schools, and it's been over 100 years of service. So the first dental hygienists in the public school systems of Bridgeport played a major part in reducing dental cavities within the children in the community by 73%. Dental hygiene practice settings have expanded over the years to include private dental practices, public health clinics, hospitals, schools, nursing homes, research, corporations, universities as educators, administrators of organizations, and public health government agencies, and many more. So our professional role of a dental hygienist includes the clinician. We are also educators. We work in public health. We work in research. We work in corporate offices. We work in administration and even entrepreneurship. We are preventative oral health specialists. We provide oral prophylaxis, which is the teeth cleaning. We provide non-surgical periodontal debridement. We take and interpret radiographs. We administer local anesthesia, provide oral hygiene instruction, provide nutritional counseling as it relates to oral health, place dental salins fluoride, and perform many other preventative services. So why are we here today? We're going to talk about the vulnerable older adult population. This population of 65 years of age and over has increased from 35 million in the year 2000 to 40 million in the year 2010, and it's projected to increase to about 55 million in 2020. According to the Center for Disease Control, 1/5 of persons aged 75 and older have no remaining teeth, and 20% of those have untreated tooth decay. So why is this age group so at risk? For advancing age, limited access to routine care, the inability to maintain good oral hygiene, and medications that cause dry mouth. So, oral health problems associated with these risks include pain, infection, loose teeth, ill-fitting dentures, severe tooth decay, gum disease, and even oral cancer. So what are the barriers to accessing oral health care? Well, living on a fixed income, the cost of oral health care, limited dental insurance for retirees, Medicare does not cover dental, the mobility limitations and lack of transportation for these older adults, and translation for immigrant older adults. It limited the number of dental providers that feel comfortable providing care to medically compromised adults, especially nursing home residents. So the population of older adults in Connecticut, to assess the oral health of vulnerable adults in the state of Connecticut, the Department of Public Health conducted a statewide oral health survey of residents of long-term care facilities. A probability sample of 20 of these facilities were selected, of which 8 participated. So a total of 419 adults were screened. The following are key findings and statistics summarizing the results of the survey done in 2013. Many vulnerable adults in Connecticut are not getting the dental care that they need. 42% of the facility residents screened needed dental care, including 4% that needed urgent care because of a pain or infection. 37% of the facility residents did not have any natural teeth, and 30% of these individuals were missing one or both of their dentures. 50% of facility residents with teeth had untreated tooth decay. And if you notice any signs of periodontal disease, caries, or candidiasis, make sure to inform the dentist or hygienist that's on the site. So almost 60% of the vulnerable adult population participants did not have any dental insurance. With such limited access to care, it is important for the nursing staff at long-term care facilities to know how to care for these patients' oral hygiene needs. Staying educated on the current methods of structured daily oral care routines can prevent disease in these older adult individuals.
It is important to keep the mouth clean not only for oral health, but for overall health. Bacteria from the mouth can travel to other areas of the body. Bacteria from other parts of the body can spread to the mouth. We only have one immune system, circulatory system, and lymphatic system, and oral bacteria and inflammation can affect the rest of the body. Poor dental hygiene can cause gum disease, heart disease, diabetes, erectile dysfunction, pregnancy problems, osteoporosis, respiratory diseases, and increased risk of stroke.
Some secondary effects of poor oral health are periodontal disease, increased risk of heart attack, increased risk of infection in individuals who already have diabetes, increased risk of respiratory infection, as Gina stated before. Oral bacteria has also been linked to diseases like Alzheimer's, arthritis, and other autoimmune diseases. Oral health status offers clues about overall health and can affect the rest of your body. So along with those effects that Gina stated before, poor oral health can also increase your risk for mouth cancer, and as well as tooth decay, bad breath, tooth loss, and gum disease. So let's talk about oral disease. Your mouth is essentially like a beehive of bacteria. There's all different kinds of bacteria in there mingling and swarming about. So without proper oral hygiene, those bacterial levels can increase, leading to oral infections such as tooth decay, which include dental cavities, or how most people know them as caries, and gum disease, which is split into two separate things. So it's grouped into periodontal disease, which is gingivitis and periodontitis. To your right, you can see a little diagram. So a couple things that allow caries to happen are the quality of the tooth structure that's already there, the bacteria that's present, which is Streptococcus mutans, and carbohydrates, especially those that are very processed and high in sugar, as well as the passage of time. So the longer you let all those three things happen, the more likely you are to have caries. Below this, you'll see the normal tooth structure versus the tooth structures during periodontitis. So a normal tooth structure will have fully encased enamel on the crown of the tooth. You'll have nice light pink healthy gums. The bone level will meet at the beginning of the crown where the root meets, versus periodontitis where you'll have deep pocketing in the gums, which allows plaque and calculus to build up, and you'll also have inflammation in the gums. So what is dental decay? Dental decay is damage done to a tooth surface, but can progress into the tooth's nerve. So here we have a little diagram of the stages of tooth decay. First, The first two stages are not typically painful. You start off with decay in the enamel, which is the outermost protective shell on the crown of the tooth. Next, you have advanced decay, which is decay that goes 50% or more into the enamel. Stage 3 decay can start to begin to be painful because it's starting to go into the dentin, which is much softer than the enamel. And the fourth kind of decay is decay that reaches into the pulp chamber. The pulp chamber is the softest portion of the tooth, and it allows all the nerves to flow through. So you would imagine this is the most painful stage. Dental caries is an infectious, transmissible, and communicable disease. A lot of people don't know that caries and cavities are a disease. So it's important for us to, as oral health educators, to inform you about what could happen in your clients' mouths. So bacterial dental plaque grows 24 hours a day. If it's not removed daily, it multiplies. The more plaque you have, the more damage you may experience and your clients. So what causes dental cavities? There are 4 contributing factors to caries development. Like we talked about before, these 4 are plaque, which contains decay-causing bacteria, the Streptococcus mutans; sugar, which feeds the plaque, creating acid; acidic foods and drinks, which can cause erosion of enamel, making the tooth more susceptible to the plaque and acids that you're eating; and time. Time allows plaque to form, sugars to create acids, and acids to erode the enamel. Over here, we just have a cute little diagram explaining all of this. So the plaque filled with the decay-causing bacteria plus sugar equals acid. Acid plus a healthy tooth is normally going to cause decay if you let it go on. How do you reduce the risk of cavities? We have a simple daily 4. Brush twice a day, floss daily, rinse with a mouthwash, and chew sugar-free gum. So by brushing at least 2 times a day for 2 minutes each time, you're going to minimize your own risk to cavities and your client's risk to cavities. By flossing at least once a day, you're able to remove the plaque that's between the teeth and under the gums. By rinsing with an antimicrobial or fluoride rinse daily for bacterial control and remineralization of the tooth surface, you're really getting all of that excess bacteria that may not be able to be reached by brushing out of the mouth. So anything that's on the tongue. And you want to also make sure that you are brushing the tongue too, because that will harbor a ton of bacteria. Think of your tongue as like a rug. Rugs get dirty really fast, especially when you have animals and you drop food on it. So scrubbing that off every time you brush is very important too. And we also know that chewing sugarless xylitol gum helps stimulate salivary flow and neutralize the pH after you're done eating. So this might be helpful if you can't brush right away, or if you have a patient who has xerostomia, which we are going to talk about.
So you've heard us talk about periodontal disease, but what exactly is it? It is a progressive disease. It is commonly referred to as gum disease, which there are 2 kinds. The first one is gingivitis and the second one is periodontitis. It is caused by bacteria found in dental plaque. The bacteria irritates the tissue in your mouth, causing inflammation and disease. Periodontal disease can be prevented by practicing good oral hygiene and visiting your dentist regularly. So in here, it's an image of a healthy mouth, and then it goes into gingivitis right after that. And then gingivitis is reversible, and if it is reversed, it can go back to being healthy, but If it is not reversed, it will advance to periodontitis, which are the two pictures on the right. And gingivitis is the only reversible stage of periodontal disease. Gingivitis, what is it? It is a form of gum disease that occurs when plaque, a sticky substance that forms on your teeth almost immediately after you brush, builds up on your teeth and is failed to be removed, causing inflammation of the gums. It is important to remember that this is reversible. However, if left untreated, it can progress to periodontitis. Treatment includes a visit to the dentist and hygienist, anti-gingivitis oral care products, and improvements to your overall oral hygiene. And periodontitis, it is a result of untreated gingivitis. Some signs and symptoms include swollen, red, or tender gums, bleeding gums when you brush your teeth, gums that recede from the tooth, bad breath or a bad taste in your mouth, pus between the teeth and gums, teeth that feel loose, and visible pus around the gums. So in the first two pictures, you can see the gums are really red, swollen, and receded. In the second one, the gums are even bleeding. And then in the last picture, they're red, swollen, bleeding. The gums are receded. There has been tooth loss, and the teeth are starting to shift.
So now we're going to talk about xerostomia, which is big in the geriatric community. So some symptoms of xerostomia or dry mouth will be difficulty tasting, chewing, swallowing, or speaking, having a sticky, dry feeling in the mouth, throat, tongues, and or lips, even a burning feeling of the tongue, and sometimes mouth sores. Some causes can be medications, systemic disease, radiation therapy, chemotherapy, and nerve damage. So sometimes when a patient has xerostomia, you'll notice that their tongue almost looks dry and fissured. It'll look like it has more detail to it. Some medications that cause dry mouth. We want to touch upon medications specifically in this presentation because of the many medications that your clients might be taking. So taking 2 or more medications increases a person's risk for dry mouth by 40%. Some of these medications that are well known for causing dry mouth are anticholinergics like atropine and Cogentin, diuretics like Diuril and Microzide, antihistamines like Dimetane and Benadryl, sedatives and tranquilizers like alprazolam and diazepam, antihypertensives like Vasotec and Monopril, antidepressants, which include Laprexo, Zoloft, and Prozac, muscle relaxants like Robaxin and Baclofen, and decongestants like Afrin and Sudafed PE. These medications are not limited to these specific ones, more the categories of these medications.
So because many of these people cannot go off these medications that cause xerostomia, there are remedies for dry mouth. The patient can sip water throughout the day. They can use xylitol products such as gum or lozenges. Saliva substitutes such as mouth coat or Biotene can be used. Moisture can also be added to the air with a humidifier. It is important to avoid caffeine, alcohol, tobacco, antihistamines, and decongestants, as these also increase the risk for xerostomia. And it is also important to use fluoride toothpaste or rinse daily due to the fact that xerostomia increases the risk for cavities.
Oral candidiasis. So oral candidiasis is a fungal infection. This first one here is denture stomatitis. This one is the most common of the oral candidiasis. The skin on the inside of the mouth is red. It is most commonly seen on the roof of the mouth and where the denture is usually placed, and the person is usually asymptomatic. The next one is denture-induced fibrous hyperplasia. This one is less common. This is caused by an ill-fitting denture, and the gums that come in contact with the dentures are red and swollen and sometimes have small red dots. So it is important that the patient has dentures that fit correctly.
So saliva is very important. It acts as an antifungal, antibacterial, and an antiviral agent. It also aids in coating and lubrication, food digestion, teeth mineralization, wound healing, and acts as a buffer against acids.
Now we're going to go into the importance of a balanced diet, not only for your overall health, but especially for yours and your clients' oral health. So a good balanced diet will help maintain blood glucose levels, prevent tooth decay, protect against anything that might harm your immune system, maintain a healthy weight, and maintain cholesterol levels. Here we have nutrition in the mouth. So some quick facts. Dental plaque eats sugar, digests it, and excretes acid into the oral cavity. We know this already. Acid is released for 20 minutes following each exposure to sugar. There are also cariogenic, which are caries inducing, and karyostatic, which are caries inhibiting foods. So here we just have a little breakdown of what kind of foods are high cariogenic and which foods are karyostatic. So high cariogenic foods include pastries and sweets, white bread and white pasta, sweetened cereal and granola bars, as well as many highly processed carbohydrate-based foods. Some low cariogenic foods are whole wheat or whole grain and breads and pastas. So these food categories can still cause caries, but they're not as damaging as the red category. So some other foods are cooked starchy vegetables like potatoes and acidic fruits and coffee. Some people will say, oh my gosh, well, fruits are great for you, but certain fruits like lemons, limes, even strawberries and things like grapes and oranges can be harmful to your teeth. So next we have neutral foods, which are red meat, pork, fish, eggs and chicken, raw high fiber veggies and nuts, popcorn, and any non-acidic artificial sweeteners. Now we go on to karyostatic foods, the foods that kind of negate any harmful acids. We have plain milk and cheese, non-citric xylitol gum, and green tea. So the green tea is an important thing. Not all teas have the same beneficial factors that green tea have. Green tea is able to kind of lower the amount of bacteria and microbes in the mouth. So that's why it's such a good option.
So the pH scale is used to measure the acidic or alkaline level of a substance. The lower the number, the more acidic the substance is. Enamel loss occurs at a pH of 4.0, and acidic foods and drinks can cause erosion. And on the left, we have two images of erosion. On the top, we see the yellowing on the inside of the tooth. And on the bottom, we have what is called cupping on the molars, which is often seen in patients with GERD, but can also occur due to erosion from acidic foods. And on the right, we have the pH scale with some different food and drinks. At neutral, we have most tap water. And at 4.0, which is where enamel loss occurs, we have coffee, white bread, and also most bottled waters, which is important to note.
So how do you keep your mouth healthy? It is important that you brush twice a day for 2 minutes, floss at least once a day. Like Nicole mentioned, it is very important to brush your tongue. You should also rinse with an antimicrobial mouthwash and use a toothpaste and mouthwash containing fluoride. It is also important that you replace toothbrushes every 3 months after being sick or if the bristles are worn.
Good morning. These are our toothbrush options. Here we have a manual extra soft toothbrush. This toothbrush is a manual soft toothbrush. We also have an example of a manual medium toothbrush. There are also hard toothbrush bristles, but we do not recommend those for any patients. For manual toothbrushing, we recommend using the modified Bass technique. Place your toothbrush at a 45-degree angle to the tooth surface, reaching into the gum line. Move it back and forth 10 to 12 times, and then use a sweeping motion away from the teeth. Use 2 to 3 teeth at a time while brushing. Continue this exercise until all tooth surfaces have been brushed. To do the insides of the teeth, place the toothbrush at a 45-degree angle with either the bottom or the top of the toothbrush. Now we have our electric toothbrushes. Here we have a Oral-B spin brush. Our other toothbrush here is better for people who have arthritis and cannot hold the toothbrush tightly. This toothbrush will be placed at a 45-degree angle to the tooth surface, aimed up towards the gums. Because it's an automatic toothbrush, the bristles will move on its own. You'll use the same motion as you would with the manual toothbrush, going 2 to 3 teeth at a time. For the Oral-B spin brush, you'll use the same motion, but usually only covering 1 tooth at a time.
Okay, the modified Bass technique. Place the toothbrush at an angle of 45 degrees. Short back and forth strokes for 10 seconds. Do it 3 to 4 teeth at a time. Brush outside and inside as well of the chewing part of the teeth. It's only gonna take 2 minutes for the whole mouth. Always use a soft toothbrush.
It is important to brush your tongue every time you brush your teeth. It removes bacteria and combats bad breath. You want to make sure to brush from back to front when brushing the tongue. So for flossing, you want to make sure you're flossing at least once daily. You can use string floss or a floss holder. Floss holders can help with people who have dexterity issues such as arthritis, or those with larger hands, and those with busy schedules such as nurses and nurses' aides. And for the flossing technique, with the floss holder, it's the same as with traditional floss. And you want to make sure to wipe the floss holder with a paper towel before moving on to the next tooth.
Okay, so here we have our floss, our toothbrush, and our mouthwash. We are going to be going over flossing today. First, we will demonstrate the string floss. You want to make sure to grab about a forearm's length, and you want to wrap it around your fingers, making sure that you always have a clean area when you go on to the next tooth, like so. Now, you want to make sure to put the floss in between the teeth and make a C shape hugging the tooth. And you want to go up and down, pulling up, and then clean area, going on to the next tooth. Make sure you're hugging the tooth, up, same thing. Now, if you struggle with using string floss, such as if you have arthritis, another option for you would be a floss holder, like so. And you want to use this the same way as you would use string floss. You just want to put it in between the teeth. Go up and down, up and down. And then once you remove it, you want to make sure to run it under water before moving on to the next tooth to make sure that the floss is clean. And another option, if you don't have a holder like this, is the disposable floss holders. And you will use it in the same way that you'll use this one. Just putting it in between the teeth and going up and down. And it's important to make sure you're flossing at least once a day. And yeah.
Denture care. Clean dentures in the morning and at night. Do this over a sink or towel to reduce the risk of breaking. Use a mild soap solution or non-abrasive denture paste to remove the accumulation on the inside of the impressions and the outer surface with a soft toothbrush. Use a daily fresh denture cleanser. You can also use a form of tablet. You have to soak the dentures for 50 to 20 minutes or overnight. Rinse and change the solution daily. After, you have to use a soft toothbrush or soft cloth daily to clean your gums and tongue.
Today we're going to be going over denture care with you. First, we'll show you how to care for your full denture. First, turn on cool water. Use a soft toothbrush or a denture brush with mild soap. Brush back and forth on the surface of the teeth with a forward and back motion or a circular motion. Be sure to get all parts of the denture. While holding the denture, you can either put your palm on the bottom of your sink, line your sink with a towel, or fill the sink up with water to protect the denture if it slips from your hands. Now we'll show you how to care for your partial denture. Use the same methods as before. Once you're finished cleaning with the brush, you'll fill up your denture holder with water and add in a tablet of either Polident or your choice of antibacterial, antimicrobial. Leave the dentures in the solution for 15 minutes or overnight. Be sure they are completely submerged in the solution for the best care. After 15 minutes, or in the morning, be sure to take the dentures out and rinse them off thoroughly. Today we're going to be
preventative care. Healthy mouth with no systemic condition needs to see a dentist every 6 months for a cleaning. History of periodontal disease and systemic condition needs to see the dentist every 3 months. Examination by a dentist, at least once a year if you have a low risk for cavities, periodontal disease, or oral cancer. Even if you wear full dentures, your oral tissue should be examined.
So if you or anyone else you know need care, we offer discount services at Phone School Dental Hygiene. It's located at the University of Bridgeport, 60 Lafayette Street. It's in the Health and Science Center building on the 5th floor. You can reach the phone clinic by calling 203-576-4137. So our pricing for services is subject to change. We do accept and bill Husky Insurance directly if you have state insurance. Just some of our pricing is for an oral cleaning prophylaxis appointment. An adult is $40, child is $25. It's an extra $15 for the dental exam. And if you need x-rays taking, a full radiographic mouth series is going to be $60. A Panorex is $35. And if you need bite wings, it's $15 for 2 or $25 for 4. We also offer student discount if you're a student of the University of Bridgeport, and additional services include laser therapy, veil scope examinations, and if you are a periodontal involved patient, we offer scaling and root planing services with local anesthesia included, and we price per quadrant. Thank you for listening, and we hope to see you soon.